can. So what I'm going to do is just to explain who we are, what we do, okay? So we are HSE, and everyone has heard of HSE, okay? But not very many people know what eHealth does in HSE, how it works, and the huge roles that we have, okay? So we are the largest IT shop in the country by miles, okay? We support directly or indirectly about 158,000 users. The only people who are bigger than ourselves are the likes of the Facebooks, the Googles, the Microsofts, okay? We have the largest amount of data, okay? We have the largest amount of systems. We support about 2,400 systems right across the totality of the domain. Most people know us for, because the health sector is always in the news, sometimes for good reasons, sometimes for not good reasons, right? And we've also been in the news for good reasons and for not good reasons. So what we do is we provide all of the IT for all of the health service. Okay? So let me just walk you through what we do and how we do it. And what I want to also try and cover as well is the type of roles, the type of jobs that we have, okay? Because of our size and scale, we have a lot of them, all right? So the first thing is, what do we actually do? Okay, so everyone thinks about a health service, HSE, it's docs and nurses, okay, who are supporting people who are not well. Look at this room here and look at the technology that's in that room. Okay? A lot of that is provided by us to support doctors and nurses do their job every day. Okay? Not only do we do that in the acute hospitals, because people always think of the HSE as acute hospitals, half the HSE does community. So any health service that's not provided in a hospital is provided in community care. And all of that technology, we also provide. Half of our resources are in hospitals and half of our resources are in community care. And the organisation wants to deliver health care as close to somebody's home as possible. So that means we're mobilising and making everybody mobile. So when you look at the HSE as an organisation, we are, as I said, the largest organisation in the state. Okay? We provide health and social services to everybody in the country. Everybody is our client. There is nobody in the state who has not or will not at some point use our services. We're state funded, right? Fully and totally. So from our vision, we are trying to provide people a healthier Ireland, the right time and the right place. From an IT perspective, we support that. We try and provide clinicians, doctors, okay, with the right information to enable them to deliver patient care. The last piece, I suppose, and I'm just going to cover here, is the budget and staff, okay? It is enormous, right? 21 billion of revenue money, okay? 1.6 billion of capital, and there's about 155,000 staff working in the health service. Within IT, okay, within the eHealth environment, we spend about $500 million a year, which is an enormous amount of money to provide services right across the totality of the organisation. So on the one side of the organisation, we would, in eHealth, we would have people who are providing business supports to our teams. On the other side of the eHealth organisation, we have hardcore techies who are writing programs, who are developing, who are developers. And we have everything in between. And we often use the phrase, from an IT perspective, we do soup to nuts. Absolutely everything is in our shop. Support, okay, hardcore techies, networks, okay, you name it, we do it. Okay, So when you look at the HSE as an organisation and the stats, just to give people, because a lot of people don't understand the size and scale of what it goes on, because they see their bit of the health service, but they don't see the totality of it. So every day, there's 4,000 inpatients, 9,000 outpatients. They're minimum, okay? There's 3,200 in ED. And yes, there's queues in ED, and that's what we're trying to sort out, okay? 180 babies are born every day in our maternity hospitals, 19 of them. We have an electronic health record in some of those maternity hospitals. Huge number of lab tests, which most lab tests don't have a human being touching them. Okay, coming in from the GP, it's an automated, okay, delivered, tracked and traced into a lab machine, and a result coming out the back of it. All supported and delivered by ourselves. In community, okay, huge number of community services that are delivered that people, again, don't particularly see. Okay, so we do 2,000 odd screening tests, cervical screening, breast check, all supported by technology. All right. Our prescriptions, okay, anybody who's getting a prescription that is covered by a medical card, fully supported by technology. You get the prescription, there's no charge, and the pharmacy gets reimbursed through our reimbursement service. And everyone always talks about loads of complaints with the HSE, and there are, but 25 a day. Okay, but look at the service that we're providing right across. So we always say big is beautiful in the HSE, okay, because it is. And when you look at the size and scale of eHealth, and I said we're one of the largest, we are fairly large. We support over 4,000 locations. There's over 2,600 directly on our network site, and we run one of the largest networks in the country, linking all the sites together at high speed, mostly dark fibre running across our backbone. Okay, we have physically 4,800 odd servers, virtualized far more than that, 10 or 20,000 virtualized servers. Okay, so we run big farms. We run big server farms. Not to the same size as Facebook, Google, and Microsoft, but they are the largest. I said we support about 83,000 end users directly, and a further about 60,000 indirectly, where we provide services to people like James's, the Mater, and other hospitals, right, and other voluntary services. We have over 70,000 devices on our network that we're supporting every day. So one of the things, and the sort of challenge is that if you look at, say, the speed to replacement for, say, PC devices, just keep it really simple. Every year we're spending 20 million quid replacing devices. Right? Making sure they're up to date, making sure they're kept correct. Validated and tested against all of our application suite. Every year they have to be validated and checked. Okay. We run about 1,075 what we call priority applications. And they're the applications that if they fall or stop working, the health service is impacted directly, straight away. So our job is to keep them running. And there's about 12 or 1,300 other additional applications that people use every day. But the priority ones are the ones that if something happens to those, we got a problem. Okay, so that's what we do right across the organisation. Healthcare, okay, has never been changing so fast. So if you went into a hospital 5 years ago, it may physically be the same building, but what's going on behind it is totally different. Okay, how it's run, how it's supported. That is a picture that I'm sure most people don't recognise unless you're from Asia. Okay, I know my colleagues in eHealth will do it because I've shown it before. All right. That's Singapore in 1950. Right. That's Singapore today. Where would you like to live? Right. So our vision is to bring the health service to Singapore like that. So how do we get from there to there. Vision, leadership, and drive. Commitment. And that's what we have in eHealth. We have a vision. We're not there yet. We have a vision to deliver an electronic health record for everybody in the country. That's accessible anywhere, anytime. That has all their information relevant to them in it. Accessible by them and accessible by any clinician who's treating you. So that's where we like to get to. And healthcare is complex. It takes time to deliver these things. Easy to say, very challenging to do. So we look at the team, okay, and because people are at these other conferences are interested to know who's there, what do they do? What do we do? So the top people here along acute, business, community, public health, they deliver directly to the services, to public health, to the acute hospitals, to our community care, to our businesses. It's an ABC with a P at the end of it, right? Acute, business, community, and public health. We then have people who support those people to deliver services. Okay, A to I, which is our access to information, all of our integration. A lot of our techies work in there. Okay, the other place our techies are working is IIS. We have one of the largest data lakes in the country to provide information right across the totality of the organisation. Because when you think about the HSE, it is a conglomerate of multiple businesses. All need KPIs, key performance indicators, all need information. And that's all coming from our side of it here. Okay? Derek and his team provide all the application support and end user support. Our help desks roughly deal with 600,000 calls a year. Again, some of the largest in the country. Okay? Helen, our CTO, okay, Chief Technical Officer, deals with all of the technology. And our two biggest teams are technology and application support. Okay? Puneet is our CISO, dealing with information security. Margaret, who's here, okay, SAPSIA, we run one of the largest SAP environments, payroll and finance. And are doing some of them, some really, really new implementations across those two areas. And Margaret and her team support that every day, 24/7, 365, because that's what the health service works. Joyce and her team Joyce and her team then put this together for us. Okay, they run the business services within and the administrative services within our organisation. And Michael, my deputy, okay, actually is the Chief Operations Officer within eHealth. We employ directly about 850 people today. We're looking this year to bring that to 1,000. And next year we'll grow it again and we'll keep growing it. So, anybody who knows me knows that Lego is not my thing. But anyway, quite often ICT, when you look at it, there's all the little bits. And what people are always trying to do is build something nice out of it. Bring it together so it looks a bit better than having all these little bits hanging around the place. But that's not really what we want to do. What we'd like to do is that. Right? Now it links to healthcare. It's not just boxes and wires. It's not just some application out there. It means something. It delivers something. Okay? And we're back to this. That's what it delivers. It delivers care to people in the community. So one of the things all the people in eHealth have, and it runs right across the health service, is a passion for delivering for people. So we all hear the thing, people, process, technology. The technology works. That's our CTO and Helen and the crew. Most of our people deliver the process and the technology. And that's the sort of people that we're looking for, because it's a people business, healthcare. I would say that's our goal in some ways, to deliver that on a pad, on a desktop, anywhere, for any clinician or anybody who needs access to that information to help treat an individual. And also making that information available directly to the patient. Anywhere, anytime. And that's ultimately what we're about and our goal. So, and the reason for this slide is, when you think about healthcare, there's labs, there's a pharmacy, there's radiology. There is a huge number of businesses that are brought together to provide one record. And that idea that is that it's in literally the palm of your hand. So when you think about a hospital and look at all the departments in a hospital, you think about community care and all the areas of community care, they're all sort of in reality businesses. They all deliver a service. It's a service to an individual, and our goal is always to put the patient, the person at the center. Not the institution, not the organization. It's the person at the center. And our technology teams, that's what they look at, how you take technology, apply it to that process, and deliver it to healthcare. We run, one of the things is I don't expect people to read this, we run some of the largest programs in the state. So when you think about a program, and I'll just pick one or two here, newborn and maternal. So we're delivering an EHR, electronic healthcare record, to all of the maternities in Ireland. First 4 are done, 2 being done this year. And if you think about an electronic healthcare record, okay, it covers every aspect of the healthcare that is being provided to you in that hospital. Every aspect is covered. We're supporting the delivery of the electronic healthcare record to the Children's Hospital, the new Children's Hospital that's being built, which will be a fully digital hospital. We've got 48 big programs. Those programs, most other organizations run 1 or 2 of. Because of our size and scale, we're 48. So we need a lot of people to deliver those programs. Project managers, program managers, techies, okay, right the way across the whole gambit. So one of the things we don't often do is a lot of people say, what jobs do you have? We have a job in virtually every part of our organization. So part of what I try and do is say, here are the things that we're doing, and now you apply that to on the technology side. So there at the top, 3.2 shared care record, that's the start of our electronic record that was going to be available to clinicians and available to individuals, okay, to support their care. Electronic referrals, the A2I team, all of the referrals that come from GPs in the hospital, delivered to ourselves. So it is a connected healthcare, supported and delivered using technology. And that's what we always try and deliver on. What about me? So lots of people come, big organization, you come into it and go, oh my God, look at the size of it. How will I ever get around it? Okay, what do I do? So one of the things that we do is we run really good induction courses run by Thelma and her team. Everybody who new joins us goes on that induction course. And they get to know people. They work in teams. We have locations in every part of the country. And I mean every part of the country. And we allow people to work at home if that's what they want to do on a 3 or 4 day a week basis. So we allow huge flexibility. So if you're living in Cavan or you're living in Donegal, we have offices in all those places. And the courses that we provide isn't just around starting off and saying, well, look, there's an induction. We do leadership courses. We do management courses. We're trying to bring people on a journey so they understand the organization and allows them to grow and deliver in the best possible way. And we also sponsor for third level courses. So people want to take their courses further, we'll sponsor it. And we do that for lots of people within the organization. So Our eHealth team have lots and lots of recruitment opportunities. I'll be asking people to pop around to the stand. As you walk in the door, we're there, okay, down the right-hand side. There's a full team there to take people through, and they'll explain to you what we're doing. They'll explain to you the sort of roles that are there, and very happy to answer and take questions. There's a quote I sometimes use, okay? But don't always get it right. Right? Not even the experts. Okay? That's important because you can't have data, you can't have it without information, and you can't have information without data. And the health service runs on both. Okay? And that is what we do. Information is actually the oil of the 21st century. It is actually what allows people to make decisions to deliver healthcare. This is a quote I got from Michael Jordan. I often think it's me. Okay, I've tried things hundreds and hundreds and hundreds and hundreds of times, and it hasn't worked. And I go back again, and we bring the team along a journey, and off we go. And eventually, yes, we do deliver, and we get it right. So what we're asking people to do is come and make a real difference to your community in an environment that is really, really positive, really helpful, and really works. And you get fantastic reward from seeing what we do and being part of that team. Some of the contact details. I say we're on the stands, happy to help, support. We have a scan me, just come along, scan it if you don't want to talk to us. But we'd love you to talk to us. Okay? I'm happy to take queries and questions. Thank you very much.